Gabby Giffords just out of surgery a few minutes ago. Now, for 4 months, she wore a helmet nonstop. We saw it here in these pictures when she was in the car, when she was getting onto the plane. We do know that there was also a decal of an Arizona state flag on the side of it. Underneath, though, her brain exposed. She had to be so careful not to fall or bump her head, and it's the only thing between her and the outside world as she makes her way up the stairs when she was heading to Houston. Today, surgeons worked to piece her skull back together, but ABC 15's Angie Holdsworth has a little more on today's operation to make Giffords feel whole once again.
Zero and liftoff for the final
just days after
Endeavour.
watching her husband, Mark Kelly, blast off on Shuttle Endeavor's last mission, Gabrielle Giffords undergoes surgery that brings her one step closer to the life she once knew.
It really is a significant step, and more than just getting the bone back, it's a marker for where we are.
After the shooting in Tucson, doctors removed a portion of her skull to allow the brain to swell. The swelling now gone, her neurosurgeon, Dr. Dong Kim, will implant a piece of synthetic bone, repairing the skull.
The edges fit in, and then it fits in perfect, as you can see. Then we take these little plates and screws. We want to put in generally one here, there, and there.
It means that you've really come a long way from the time when your skull needed to be removed.
Valley neurosurgeon Nader Sanai has performed the surgery many times. There is only a minor risk for infection.
Strength, as I said, is as good as it is before the entire operation. Typically what will happen over the course of years is that those bone plates will fuse together.
Giffords may also need to have a shunt permanently implanted to help drain excess fluid from her brain. This next phase, one that brings about new hope for what's possible in the face of tragedy. Angie Holdsworth, ABC 15.